Hi everyone, in this video we are going to deal about the long bone of upper limb humerus. So in upper limb we are going to see some set of bones. Among that, the long bone which is seen in the arm region is humerus bone, which we are seeing in this video. So this is the whole of the humerus which we have got, and this humerus we are going to deal about the features in detail. So to talk about the features of long bone, we are going to see according to three parts, such as we have got upper end. So this is the upper end, and this whole part is the shaft, and then this part is considered as lower end. So we are going to deal about features of three parts such as upper end, shaft and the lower end. Now before moving into the details of features, first we have to know what is the proper features for finding out which side it is, that is proper anatomical position of this humerus we are going to find. So we have got humerus on either side, so it is bilaterally present. So we have got right and left humerus. To find out that whether it is right or left, we have got some points to consider, such as first taking to the upper end. So in the upper end we have got head of the humerus. So this part is called as head of the humerus, and this head of the humerus always should face medially. So medially we have got a glenoid cavity of the scapula to articulate with this humerus to form the shoulder joint. For that purpose, we have got the head of humerus facing medially. So that is the first point we have to remember for keeping it in proper anatomical position. So head always will be facing medially. And then if you are moving towards the lateral aspect of upper end, we have got a bony elevation. And this bony elevation which you are seeing is greater tubercle. So the bony elevation which we are seeing in humerus is usually called as tubercle, which we have two in number. One is greater tubercle and the one is lesser tubercle. The lateral one will be greater tubercle. So in that position you have to keep upper end head facing medially, greater tubercle facing laterally. And moving on to the shaft. In the shaft again we have got some surfaces. Among that we have to note for the posterior surface. So in the posterior surface of this shaft we have got a groove. So here you can make out a groove will be seen. So this groove is called as spiral groove or radial groove, which is seen in the middle of the shaft of humerus. So this is also one of the feature we have to remember. In the posterior surface we have got the spiral groove. So we have to keep that in posterior aspect. And moving on to the lower end. So this is the lower end. So in the lower end we have got some features such as we have got medial. So this is medial aspect and this is the lateral aspect. Okay, so this medial aspect and this is lateral aspect, and here we have got medial epicondyle and lateral epicondyle. Now in this aspect we have to see again posteriorly. Posteriorly we have got a larger fossa. So here you can make out the fossa which is seen posteriorly is olecranon fossa. So this fossa is called as olecranon fossa, which is deeper and seen posteriorly. Moving on to the anterior aspect of humerus. So here in the anterior aspect, lower end we have got two fossa, such as first one we have got radial fossa above the lateral side, and another fossa which is seen above in the medial aspect is coronoid fossa. So these are the features you have to remember while we are holding the bone in proper position to find out whether it is right or left. So by seeing all these features we can make out the bone which we are seeing here is right sided humerus. So right side humerus having head medially, and in the posterior aspect we have got our olecranon process, and in the shaft we have got posteriorly spiral groove. So now we will move on to the general features of this bone in detail. To move on to features, we are going to again divide this as we have got upper end, shaft and lower end. First we are moving on to upper end. In the upper end we have got around 5 features placed. So we are going to see the features. So now we are going to see features only in the upper end. So in the upper end we have got around 5 features. Among that, one is head of the humerus, and then we have got neck of the humerus. So this constricted part is called neck, that is anatomical neck, and another neck is seen between the upper end and the shaft. This constricted area is called as surgical neck. So we have got two necks present in the humerus. One is anatomical neck, which is present between the tubercles and the head. This is called as anatomical neck, and another neck present between the upper end and the shaft. We will call this neck as the surgical neck. So we have got two features, head and neck. Now we are moving on to tubercle. As I said earlier, we have got two tubercles such as greater tubercle in the lateral aspect and the lesser tubercle in the medial aspect. So we have got altogether four features. The last one is intertubercular sulcus, this one. So this is the intertubercular sulcus which is present between two tubercles. Between the lesser and the greater tubercle we have got a depression, a linear depression you can make out here. This is the intertubercular sulcus. So altogether we have got five features present in the upper end: head, anatomical neck. This is the anatomical neck, and this was one as the surgical neck between the upper end and the shaft. And then we have got two tubercles, lesser and greater tubercle, and then we have got intertubercular sulcus. This is intertubercular sulcus. Now moving on to the head. Head, you know, it is convex and it is going to articulate with the glenoid cavity of scapula to contribute for shoulder joint, which is an example of synovial joint. Variety will be ball and socket variety. Moving on to the neck feature, as I said, we have got two necks. One is anatomical neck, and this is the anatomical neck which is seen between the head and the tubercles, and this is the anatomical construction. Now moving on to the surgical neck, here we have got between the upper end and the shaft. Why it is called as surgical neck is, it is clinically very important for surgery purpose, because in this neck we have got two important structures such as axillary nerve and posterior circumflex humeral vessels. So a nerve and vessel will be related over this region of the humerus. So this surgical neck is considered as an important point, such as when fractures happen in this bone, it will usually affect this point, that is surgical neck of the humerus. Talking about the tubercles, we have got two tubercles, lesser and greater. In the lesser tubercle, usually tubercles or tuberosity or whatever elevation present in the bones are mainly because of the muscle attachments. Muscles or ligaments will get attached and it is going to pull the bone towards its insertion. That's why all these elevations are happening in the bones. So now in humerus, you know, we have got two tubercles, that is also a elevation formed by muscle attachment. So here this lesser tubercle thus contributed by attachment of subscapularis muscle. So the muscle which is coming from scapula getting inserted into this lesser tubercle, this one. And then we have got behind this as greater tubercle, and in this greater tubercle posterior aspect we have got three muscles attached from above downwards, such as sit muscles. You can remember this mnemonic as SIT, sit muscles, such as supraspinatus and then infraspinatus and teres minor. From above downwards behind we have got these three muscles getting inserted. All are coming from the scapula. So above supraspinatus, middle infraspinatus, and in the lower part teres minor. And moving on to the fifth feature, that is intertubercular sulcus. That is a sulcus or depression seen between greater and lesser tubercle, and this sulcus is going to provide a passage. A sulcus or groove is present mainly because of some structure passing through it. So here the main structure which is contributing for the passages, we have got tendon of long head of biceps passing through this sulcus. So through this sulcus we have got tendon of biceps passing, so that's why we have got a depression over here. And then we have got two lips on the either side of the sulcus, such as medial lip and then one is lateral lip, and this part is called as floor of the intertubercular sulcus. So here we have got some muscle attached, such as medial lip of the intertubercular sulcus giving attachment to teres major, and lateral lip giving attachment to pectoralis major, and then in the floor we have got attachment of latissimus dorsi. So these are the three muscles getting attached in the intertubercular sulcus. Here you can remember a mnemonic like lady between two majors, such as lady will represent latissimus dorsi, which is seen in the intertubercular sulcus floor, and on the either side lips, medial lip gives attachment to teres major and lateral lip for pectoralis major, lady between two majors. So these are the features happening in the upper end. Now we will move on to the shaft of this humerus. Talking about the shaft, we have got a area between the upper end and the lower end. So this area is called as shaft of the humerus. In this shaft we have got 3 borders and 3 surfaces. The 3 borders are, we have got anterior border, we have got this as anterior border, and this is medial border, and this is lateral border. So between these borders we have got some surfaces, such as between the anterior border and the medial border, this surface. So we have got this surface as anteromedial surface, this whole surface between anterior and medial border, anteromedial. And same way here, between the anterior border and the lateral border we have got anterolateral surface, this whole part. And behind, between the medial border and the lateral border, this whole surface is called as posterior surface. So altogether we have got 3 surfaces present in the humerus, such as anteromedial, here anterolateral, and then posterior surface. So these are the 3 surfaces and 3 borders we have got in humerus shaft. Okay, and moving on to the attachments, here we have got again in the anteromedial surface. If you are seeing the anteromedial surface, middle part we have got attachment of a muscle called coracobrachialis muscle. So in the middle part we have got attachment of coracobrachialis in the anteromedial surface, and in the lower part of the humerus, contributed by both anteromedial and the anterolateral surface, whole lower part is giving attachment to a muscle called brachialis. So anteromedial middle part giving attachment to coracobrachialis. In the lower part, both anteromedial and anterolateral both are giving attachment to a muscle called brachialis. Moving on to anterolateral surface, here you can make out a elevation. So this elevation, so this elevated part you can make out, I guess. So this is the elevated part seen in the anterolateral surface, which we will call as deltoid tuberosity. So this deltoid tuberosity, as the name indicates, it is going to give attachment for deltoid muscle. So deltoid tuberosity in the anterolateral surface giving attachment to deltoid muscle. The remaining part in the lower part, same like anteromedial surface, giving attachment to brachialis muscle. Moving on to posterior surface, as I said, just behind the deltoid tuberosity, in the posterior aspect, we have got a groove. So this is the groove which we have. We have got a small depressed area which we will call a groove, and this groove is called as spiral groove or radial groove. Why it is called so is, we have got some structures related over here, such as we have got radial nerve and profunda brachii vessels passing through this spiral groove. So spiral groove is a very important thing for which they will ask for viva. Here in the middle of the shaft we have got posterior surface with spiral groove having 2 structures, radial nerve and profunda brachii vessels. So now we have seen 2 areas where nerves are related. One is in the cervical neck axillary nerve. Here in the spiral groove we have got radial nerve with a vessel called profunda brachii vessel. So this much if you are remembering and answering, that is more than enough. Now we are moving on to lower end. So these all about the details of shaft. Moving on to the lower end, again we have got expanded part of humerus in the lower part. Here again we have got medial aspect and lateral aspect. In the anterior surface of the lower end we have got 2 features, 2 elevation in the middle part. One is laterally we have got a capitulum. So this elevated part is called as capitulum, and here we have got medially a pulley shaped bony part which we will call as trochlea. So this is capitulum and this is trochlea. Capitulum is a bony elevation which is going to articulate with head of radius, and here trochlea it is going to articulate with ulna by its trochlear notch. And then above this capitulum we have got a depression over here. So this depressed area is called as radial fossa, and the depressed area which is seen above the trochlea, here we will have a fossa called coronoid fossa. So laterally radial fossa, and this fossa is called as coronoid fossa. 2 depressions seen above the capitulum and the trochlea, and these depressions are mainly for the lodging of head of radius and also for the coronoid process of ulna during the flexion action happening in the elbow joint. And now we are moving on to epicondyle, that is a bony point seen on the either side. This is medial epicondyle and this will be lateral epicondyle. and this medial epicondyle is going to give attachment to common flexor muscles of forearm, and here we have got common extensor muscles of forearm taking its origin. Moving on to the posterior surface of lower end, we already have dealt. We have got a deep depression seen in the posterior aspect of lower end, which we will call as olecranon fossa. And this olecranon fossa is going to lodge the olecranon process, which is coming from ulna during extension action. So the movement called extension is going to hold the olecranon process in this fossa. So we are calling it as olecranon fossa. So these are the details you have to remember, and one more important thing which you have to remember is this is medial epicondyle. Just behind the medial epicondyle we have got a nerve passing, and the nerve which is related behind the medial epicondyle is ulnar nerve. So we have got three nerves relation which we have to remember. One is a nerve which is seen in the cervical neck, that is axillary nerve, and one more nerve which is seen in the shaft of humerus behind, that is radial nerve, and one more nerve which is seen in the area behind medial epicondyle here, that is ulnar nerve. So these are the details we have to remember while we are explaining about humerus. Thank you.